Regenerative medicine is a therapy that we can provide for pets that helps to heal soft tissue injuries such as tendon and ligament sprains, muscle sprains, and osteoarthritis. There's two different procedures that we can perform, and these are called PRP, which stands for platelet-rich plasma, or stem cell therapy. With PRP, we take a blood sample from the pet and we spin this down to collect the platelet-rich fraction of the plasma. When you inject this into joints, this can help to recruit growth factors and healing properties that can help to regenerate cartilage and heal any damaged areas such as in the muscles or the tendons. It's one of the only therapies available for actually regenerating and healing damaged cartilage, and it speeds up healing in the case of soft tissue injuries. Stem cells is similar, except that instead of taking a sample of the blood, we take stem cells from the bone marrow. These are then harvested in a similar way to platelet-rich plasma therapy, where we spin down and preserve the cells. The cells are then injected into the area as required, for example, in an osteoarthritic joint, and they can recruit other cells to promote healing and reduction of inflammation and pain in those joints. Again, a really good therapy for something like osteoarthritis, where severe damage to cartilage has occurred, and it's slightly different to traditional therapies, which are pain relief, because the pain relief only acts to help with pain. It doesn't cause any repair of the tissues, and it doesn't improve the situation that's occurring in the local area. It helps with pain, so it will help your pet to be more mobile and to feel better. So these, pain relief anti-inflammatories, for example, have a really good place in osteoarthritis. But if we want to get some improvement on cartilage, wear and tear and damage within the joint, then we need to look at something like regenerative therapy.
This is an example of what would be contained in the kit. First, we draw up a solution called an anticoagulant prior to taking our blood sample. We then sterilely prep the skin on the patient, and we're able to take our blood sample from here and to prep it ready for collecting our PRP. Whilst the sample is being prepped, we will also prepare the area to be injected. So this is an example of a hip joint PRP injection, where we are clipping the fur, scrubbing the area to perform a surgical prep. Here you can see me injecting the blood sample into the first collection vessel, and this will go on to a cycle in the centrifuge where we will spin it down to get the first fraction, and then the process is repeated to get the second fraction in order to get the platelet-rich plasma fraction only and discard the parts that are not required. Once the plasma has gone through 2 cycles on the centrifuge, we can then discard the part that we don't use, leaving our concentrated platelet-rich plasma to be injected into the joints. Once we're ready to inject the sample, we locate the joint using a plain needle and syringe, draw back to check that you have got joint fluid, and then you're ready to inject the sample. We can inject approximately 2 mL per joint.
So that video shows you how we prepare and inject the PRP. It's slightly different for stem cell, but that's because we take the sample from the bone marrow rather than a blood sample. But the prep and the injection procedure is the same. Your pet can feel a little bit of discomfort for a few days afterwards because we may have injected into a painful area, but that should subside quickly and we can give pain relief for that. We get good results from this, and in the majority of cases we see these results for at least 6 months, and in some cases up to 12 months or longer. Please let us know if you'd like any more information on this. It can be found on our website, thevetstation molesey.co.uk, or you can always send us a message directly.